We're now going to show you an unusual cause of pulmonary arterial obstruction. This is the uncle of a former technologist that worked in MRI, and her uncle presented at the age of 64 with a relatively short history of shortness of breath, pleuritic chest pain that lasted about 3 months before being admitted. The dyspnea had been mild, but had gradually become pronounced to the point where he had to rest after walking 1 or 2 blocks. The right lower pleuritic chest pain had been intermittent during these last 2 or 3 months. The frontal chest rentgenogram showed a small right lung which appeared hypovascular, and the right hilar shadow is also relatively small. The lateral view of the chest shows a small right pulmonary artery. The perfusion scan to your left shows no perfusion of the right lung. The ventilatory scan to your right shows hypoventilation diffusely seen throughout the right lung. The diagnosis of a massive obstruction of the right pulmonary artery due to pulmonary thromboembolism was suspected. There were no signs of deep vein thrombosis nor hematological findings suggestive of a thrombogenic diathesis. A pulmonary angiogram confirmed the suspicion of a complete obstruction of the right pulmonary artery. The patient was treated with anticoagulants, and his dyspnea did not improve, actually got worse, and he presented then with hemoptysis. Note on this frontal chest rentgenogram a thick-walled cavity in the right lung. A CT examination showed a mass in the right hilus and discrete peripheral densities in the right lung. Axial images, top row, and coronal images, bottom row, of this patient showed a mass in the right hilus and at the bifurcation of the right bronchus with an increased signal at the level of the cavity of the right lung. The patient died shortly after the MR examination, and at post-mortem study, one can see a photograph from behind a small right lung, a mass at the bifurcation of the trachea and in the right hilus as well. The histological diagnosis of this mass was malignant fibrous histiocytoma. Retrospectively, if we see a mass associated with occlusion of a vein or of an artery, we have to assume that the mass was not a simple thrombus, but a possible sarcoma of the wall of the vessel, or a tumor that involved secondarily the vessel. In this case, the presence of the mass was suggestive that this patient had a sarcoma of the right Primary sarcomas of the pulmonary artery include undifferentiated sarcomas, leiomyosarcoma, spindle cell sarcomas, malignant fibrous histiocytoma, fibrosarcoma, fibromyxosarcoma, rhabdomyosarcoma, chondrosarcoma, mesenchyma, osteosarcoma, myxosarcoma, hemangiopericytoma, angiosarcoma, osteoid chondrosarcoma, embryonal rhabdosarcoma, myxo or myosarcoma, fibroleiomyosarcoma, angiofibromyosarcoma, and hemangioendothelioma. This young man presented with progressive dyspnea and an apparently negative frontal chest rentgenogram. We can faintly see a density that projects at the level of the tracheal bifurcation. However, in the lateral projection, note that there is a heavy calcification in topography of the pulmonary trunk. This proved to be a sarcoma, an osteosarcoma, actually, of the pulmonary valve.